All right, so welcome back. Today, what we're going to do is we're going to talk about cardiovascular health. I know it looks a little weird on the screen. I'm not sure why that R got shifted down, but we're going to talk about cardiovascular health today. And so, when we're talking about this cardiovascular health, what we're really going to talk about is cardiovascular disease. We're going to be talking about cardiovascular disease along with cardiovascular health, and they're very interrelated because if you don't take care of your cardiovascular health, there's a good chance it'll lead to cardiovascular disease. Now, if you think back this entire semester so far, what you'll have known or what you'll have seen is that I've talked about cardiovascular disease and cardiovascular health pretty much every class, multiple times each class, and that's because it's a big thing. Cardiovascular health and cardiovascular disease are something that you guys have all heard about before this class. You'll hear after this class, and you've heard all the way through this class. And it's just a very important topic for us to talk about. But the big problem is if I was to ask you guys what cardiovascular disease actually is, most people don't fully know. They know that it has to do with their heart. Some people know that it has to do with maybe your blood vessels. But there's a lot that goes into this cardiovascular health and cardiovascular disease, and people don't truly know what it is. So, in this particular lecture, what we're going to do is we're going to talk about what are some of the things that lead to having bad cardiovascular health or good cardiovascular health? What are the risk factors associated with developing cardiovascular disease? We'll talk about what the disease actually is, and then kind of like what do we do? Like, what do we do with it? Can we treat it? There are some treatments. But what can we do to prevent it, which are things we've talked about really all semester. So this is kind of summarizing a lot of what we've said in regards to cardiovascular health. So where we're going to start this conversation is we're going to start with talking about what we call risk factors. And so when it comes to cardiovascular health and cardiovascular disease, we have what we call risk factors, which are things that put us more at risk for developing heart disease or cardiovascular disease. And we'll talk about what it actually is about halfway through the lecture. So, what are some of the things? So, you guys on here today, what are some of the things that you think maybe put you more at risk for developing heart disease or cardiovascular disease, things like heart attacks? What do you think would put you more at risk for that?
I would say you can get it from you can hereditary, so from your parents, and then obesity.
Okay. Yeah, so those are two good examples. So there's heredity, so what we get from our parents, and then there's also things like uh, being obese. Uh, are there other things you guys can think of that maybe put you more at risk as well? Yeah, so there are other examples that we'll look at throughout this. And so where we start this at is we talk about uh, the major risk factors that are changeable. So someone had just posted maybe not enough exercise. So yeah, these are good things. So where we start is major risk factors that are changeable. So these are things that we have control over and are major risk factors in our development of developing cardiovascular disease. So let's talk about the biggest one that people typically think about, and that's tobacco use. Okay. So tobacco use of any type, and especially smoking, but also smokeless tobacco, e-cigarettes, and vaping as well. These are major risk factors, meaning that if you use tobacco products, you are very likely to develop cardiovascular disease at some point in your life, especially the longer that you use them. So think about that as just being this big risk factor, something that has a major impact on whether you're going to develop that. And then we say that it's changeable. So when we think about tobacco use, it is something that we have control over. So changeable or something we actually have control over. You have control over whether you use tobacco. You can change whether you use tobacco or not. Now, I'm not saying this is an easy process. It can be very difficult, but there's no one usually at the end of the day putting a cigarette in your mouth and holding your mouth shut and holding your nose shut, saying "breathe or die," and making you smoke. If there is, please reach out because we can help you with that. But tobacco is something that is a major risk factor, and it's something we have control over. Now, the way I want you to think about some of these things is your cardiovascular system is your heart and vessels that move the blood around. And so typically when we look at cardiovascular disease, we're looking at the damage that happens in the vessels. So think about your vessels kind of like a garden hose. Okay. So think of like a garden hose you'd use outside that runs water through it, except ours runs blood. And what happens when you use tobacco products, there are chemicals that are introduced into your bloodstream, or things introduced into your bloodstream that can cause damage over time. So think about if someone took a bunch of crushed up glass, like really small pieces of glass, and they started pouring them into the water that was going through your garden hose. Well, initially there might not be any kind of problems, but over time, what might happen is the inside of that garden hose becomes damaged because of all the glass that's going on inside of it, or running through the inside. And that's kind of what tobacco does to um, our vessels. We also have things like high blood pressure. So high blood pressure is your heart having to work too hard to move that blood through your vessels. Um, this is something we do have control over through the things that we eat and through exercise. Some people are predisposed to having high blood pressure, and it may be more difficult for them to lower that. But if they are put on um, medications, like if their doctor puts them on medications to help lower their blood pressure, we would consider that to be something you could actually control. Um, think about if that pressure gets too high for a long time, it could cause damage to that garden hose, just like it would our vessels if you have a lot of pressure in that. We then have unhealthy cholesterol. So our unhealthy cholesterol was our LDL cholesterol. This is mainly affected through our diet. So we want to help lower that, keep that in a normal range. And if our unhealthy cholesterol isn't controlled, like if we're eating perfectly and it's still high, we can have medications which will help control this. And remember, cholesterol is simply a measure of how much fat is in the blood, and too much fat in the blood is going to cause our risk of cardiovascular disease to go up, which will make more sense here in a few minutes when we talk about it. Being physically inactive. So when you don't exercise enough, we know that this can lead to cardiovascular disease. When you exercise, your heart and your muscles get stronger, and so do your vessels. Your vessels actually become stronger when you exercise as well. So being physically inactive predisposes them to cardiovascular disease a little bit more easily. Obesity does this because your entire body has to work harder to keep you alive. And then finally, we have diabetes. Diabetes is, again, a major risk factor that we have control over. Now, realize at the end of the day, there are three types of diabetes. They all work a little bit differently. There's type 1, type 2, and gestational. Regardless of what type it is something that we can control, and it does cause an issue as far as cardiovascular health goes. So diabetes is simply not being able to control the amount of sugar in your blood very easily. And so think about if your body has trouble with this, you could have high amounts of sugar in your blood, and this could cause a problem. And the way to think about this would be if you spilt a gallon of water in your house right now, and you just let it sit there, like you let it just dry on its own. Well, after a couple of days, that spot where you spilt that gallon of water may look a little like discolored, but for the most part, that area would be fine. You wouldn't really know that much had changed in that area besides maybe some discoloration. However, if you spilt, instead of a gallon of water, you spilt a gallon of McDonald's sweet tea, so like has a lot of delicious sugar in it. But you spill a gallon of sugar in, or a gallon of McDonald's sweet tea in your house, and again, you didn't clean it up, you just let it dry normally. What you would notice a couple days after that happened is when you walked across that spot in the floor, you would notice that it's really sticky. Like literally your shoes are sticking to it. You hear that sound of your shoes sticking to it, and you can feel it. Well, that same thing happens over time in your bloodstream. If you have diabetes and you have high levels of sugar in your blood, over time, what may happen is the inside of your vessel becomes very sticky, and it makes things very easy to stick to that, and that's going to lead to cardiovascular disease over time. And so we're looking at all of these things. Realize with diabetes, if you do have it, you can't ever get rid of your diabetes, but you can have what's called controlled diabetes or managed diabetes, where you're eating right, you're exercising, you're taking medications your doctor recommends, you're keeping your blood sugar pretty much where someone who doesn't have diabetes in the same area. And so this would be considered controlled as well. If you are uncontrolled diabetics, maybe you're not taking your medications, you're allowing your blood sugar to get really high and stay really high, and this can cause issues over time. And so we have our major risk factors that are changeable. And so, with that being said, if we have our major risk factors that are changeable, what else do you think we have to talk about?
The unchangeable risk factors.
The unchangeable risk factors. Now, that's a great guess, but I kind of set you up for losing there. But we actually have other risk factors that are changeable. And so, what these are is these are things that do play a role in your cardiovascular health, but maybe we don't know how big of a role they play, or maybe they just don't play as big of a role as the things on this list. And so when we look at it, we would rather you, if you had to choose, we would rather you work on a major risk factor. But other things that we do have to consider are these things as well. So triglycerides is another way we measure fat in the blood. And so if these are elevated, it can lead to cardiovascular disease, just like cholesterol would. And this is something we can also change with exercise and diet. Um, but when it comes to it, if you had to pick between your high triglycerides and your tobacco use, we'd rather you work on your tobacco use when it comes to cardiovascular health. And so we also have metabolic syndrome. So there's all different kinds of things like that may affect how you make and process energy, from thyroid issues to there's a whole list of them. If you have any of those, they can be worrisome because anytime we're messing with how the body makes energy, it can affect a lot of different systems in the body. But if you take the medications your doctor recommends, these are not a huge issue. We have psychosocial factors as well. Think psychosocial is think psychology. It's kind of to do with the mind, social, how we interact with others. And so psychosocial factors are a wide range of things that may actually make it more or less likely that we develop cardiovascular disease. Some examples of things like this would be um, how you would handle maybe anger or how you manage stress. If you are stressed out a lot or if you get angry very easily, you could be more at risk for um, cardiovascular disease because it's increasing heart rate, it's increasing the amount of work your heart has to do in damaging those vessels. And so there are lots of things that can go into this. And then finally, we know that alcohol and drugs uh, are risk factors when it comes to cardiovascular health. And these are more, not that we know that they're not that dangerous, it's more the fact we don't know how dangerous they are. When it comes to alcohol, there's kind of mixed results. As far as that, we know that excess alcohol consumption, so anytime you have that buzzed feeling, um, anytime we talk about alcohol, we know that this excess alcohol use is going to increase cardiovascular risk. But there's some evidence and plenty of people that say a limited amount of alcohol, a little bit of alcohol in your in your use throughout your life may actually help lower those risks. We know that alcohol can help with different things, and we know that it can be good for we think that it can be good for cardiovascular health, but we're not sure at the end of the day. There's no full consensus on how much is a good amount to use. There are studies that say zero amount of alcohol is healthy because it is seen as a poison in the body. Um, there are some reports. There was one about a year and a half, 2 years ago that said 3 to 4 drinks a day was actually beneficial for heart health. That's a pretty extreme measure. A, that's expensive, and B, that seems like a good bit of alcohol to be beneficial. The most widely agreed upon consensus that you hear about is usually people saying a few drinks a week or maybe 1 drink a day can be beneficial in your heart health, especially if it comes from something like red wine, because there are extra nutrients inside that red wine that help with heart health. But at the end of the day, there's no like, ooh, we know exactly this is how much you should get in order to help you with your heart health. And so you do want to be careful with it, knowing that a little bit can be useful, but a large consumption of alcohol is not going to be good for your heart health. It will actually make it worse and make you more likely to develop cardiovascular disease. And if you have the risk of becoming an alcoholic, we say that no alcohol use is your best, because that would negate any kind of benefits that you saw from that. And then we also know other drugs, so things that are not alcohol and tobacco. So it could be marijuana, it could be crack and cocaine, heroin, methamphetamine. We know that these can lead to issues with cardiovascular disease to increase your risk for those, but we're not exactly sure how much because of several different things. Most people that use drugs of those types tend to use multiple things. They don't just use heroin. They don't just use marijuana. They tend to use multiple drugs, and so you can't pinpoint it. Also, they're illegal for consumption, and so you can't research that by saying, "Hey, I'm going to give you heroin for the next 20 years, and we're going to see how that changes your risk for heart disease." Those things are not ethical, but we do know that they increase your risk. They're probably major risk factors, especially any drug that's used intravenously, meaning you inject them into the vein because you are damaging some of the blood vessel through that use. And so these are other risk factors that are changeable. These are important, but if you had to choose, we would much rather you choose something on the major risk factor to change first and then work on these. Um, and then so finally we get to what you had suggested of we do have major risk factors that are unchangeable. So these are the things that we don't have control over. They're things that we really at the end of the day, they're just kind of what they are. And we have to use those to evaluate our risk. And they may make it more likely or maybe make us think twice about changing some of the things we can. And so things on this list are our heredity or our genes, our DNA. We get these from our parents, and we don't have control over those over our DNA. At least yet, we don't. Science one day may have it where you can control your heredity, but we don't currently. And so we know that if you look back in your family history or maybe your parents, if your parents had a major heart attack or died of some kind of cardiovascular event, so something like a heart attack before the age of 55, you are much, much more likely to develop cardiovascular disease during your life than someone who didn't have a parent that did that. Our genes do play a very vital role in this, and it's something we can look at. However, they don't play the entire role. Just because you could look back in someone's family history and see that every person in that family had died by the age of 50 of a heart attack, that doesn't mean that that person's going to die of a heart attack before the age of 50. It means that there's a good likelihood that it could be a problem for them. And so if you know those types of things, you're really going to want to focus on all these risk factors to help mitigate those risks of developing cardiovascular disease. Also, you could look back in your family history and no one's ever had cardiovascular disease. No one's ever had a heart attack. That doesn't mean that you can't develop it on your own. If you start smoking a lot and eating unhealthy and not exercising, you can develop cardiovascular disease very quickly. We also know that aging plays a role. So the older you are, the more likely it is that you are to have cardiovascular disease. When we look at the disease, it'll make sense. But this is a disease. It's called a chronic disease. It develops over time. It's very uncommon for us to see kids having cardiovascular disease. We are starting to see that. We do see kids with it. It's still unlikely for us to see 20-year-olds with cardiovascular disease because this disease progresses over time. The older you are, the more likely it is that you develop it. If everyone lived to be 200, 250 years old, probably everyone would come down with cardiovascular disease because of the way it works. Realize in most kids, by the age of 5 or 6, you have the very beginning signs of cardiovascular disease. All of you guys in this class already probably have the very beginning signs of cardiovascular disease if we were able to cut you open and look at it. Now, this is not a bad, this isn't something like, oh, my health is in danger today. It's not. It's not something we're overly concerned about. We're just saying that it starts now. And if we make poor choices, lifestyle choices for a long period of time, this is going to get more out of hand to become an issue. So if you think about something that develops in someone at the age of 5 or 6 and they live to be 80, 85, well, that disease has had 80 years to grow inside of their body. And so if they're not doing the things that are best for their cardiovascular health, it gives it a long time, even at a slow growth, for that to become an issue. We know that males are more likely to develop cardiovascular disease. Testosterone that is high in males tends to lead to cardiovascular disease a little bit more than estrogen levels that are high in females. We know ethnicity plays a role as well. And so we know that Africans, so people of darker skin complexion is really how it's related. But Africans, like from Africa, have higher rates of cardiovascular disease than other races do. If you're African American, you are at an increased risk, but maybe not quite as high as it is if you literally your family just came from Africa. Um, and some of that has to do with heredity. Um, and so we look at those things, and we also have some ethnicities that have lower rates of cardiovascular disease. Their risk of developing it are much lower, and this would be Asians. Asians tend to have very, not very rarely, but they have they're very unlikely to develop cardiovascular disease. And so when it comes to that, that allows us just to focus on different things. So if you're a male African or a male African American, you have a high chance of developing cardiovascular disease, especially as you get older in life. And so we want to focus on those risk factors from above a little bit more. If you're an Asian female, especially a young Asian female, but even an older Asian female, we're not as concerned about that. But that being said, we are created in a really cool way in the fact that typically things kind of even out. We were created in a way where things kind of even out. And so where maybe African American males have to worry a lot about cardiovascular disease, and we know this when we look at everything, there is a disease that we've talked about in this class that they don't have to worry about nearly as much, and that is osteoporosis. So osteoporosis, the weakening of bones, is a little bit different. So osteoporosis happens more in females than in males. Um, and the people who are least likely to suffer from osteoporosis are Africans and African Americans. The ethnicity that is most likely to suffer from osteoporosis are Asians, especially female Asians. And so, what we can see is that when we start to know these things, it does allow us to kind of make a plan specific to someone, even if we don't know their entire history. If I was working with someone to improve their health and they were a female Asian, we're going to work on making their bones stronger and working on osteoporosis. They probably got a pretty healthy heart. If I had an African American male, especially if they're a little bit older, you would want to focus on heart health and cardiovascular health. And I actually don't need to worry about their bones all that much. It's very uncommon for male Africans, male African Americans to develop osteoporosis. Not unheard of, it's just not as likely. And then finally, we have inflammation or swelling, and we're talking about of your organs. So this occurs for various reasons. You don't fully have control over this, but if your organs inside of you are inflamed for long periods of time, this can lead to cardiovascular disease. Is all that making sense so far?